Stand up right now if you can. Go ahead. I'll wait a moment. Now, pay attention to how your body feels in this instant. Do you notice any aches, stiffness, unusual tiredness, or subtle discomfort? Many people notice these things but quickly brush them aside without giving them much thought. But here's something important. Some of the most serious health issues don't announce themselves loudly. They whisper softly, almost unnoticed, until it's much tougher to step in and address them effectively. And one of the most dangerous of these quiet warnings often comes from your pancreas, that small yet incredibly important organ hidden behind your stomach. I'm Dr. Michael Kent. For more than 25 years, I've focused on caring for adults over the age of 60. Time and time again, I've observed that while aging certainly accounts for many physical changes, it doesn't account for everything. Serious conditions have a way of hiding themselves cleverly, masquerading as nothing more than normal aging. Pancreatic cancer is a particularly sneaky and dangerous example of this. It starts so silently, with very subtle hints that are remarkably easy to dismiss or explain away as something minor. Many people picture pancreatic cancer as something that hits hard and fast, with intense, obvious pain or dramatic symptoms appearing out of nowhere. But the reality is usually very different. It tends to develop slowly over months, showing itself through quiet, understated clues, weight loss that happens without any clear reason, mild but constant discomfort in the back, small ongoing changes in digestion, or new issues with blood sugar control. Taken one at a time, these can feel insignificant, every day, or simply a normal part of growing older. Yet when several of them begin appearing together and forming a pattern, they send a signal that truly shouldn't be ignored. Over the next 20 minutes or so, I'll guide you through the 6-step early protocol I've created and fine-tuned over the years specifically for recognizing these early pancreatic warning signs. This draws straight from well-established research and clinical experience at leading institutions like Johns Hopkins, the Mayo Clinic, and the Cleveland Clinic. The goal here isn't to frighten anyone, it's to help build real, practical awareness so you know exactly when those quiet body signals deserve your attention and prompt follow-up with a doctor. Before we go further, please drop a quick comment below with just your age. It gives me a better idea of who's listening, so I can tailor the details in future discussions to fit different age groups more effectively. Let's begin with what's actually taking place inside your body, explained in plain, clear language that many people never hear. As you enter your 60s, 70s, and beyond, the pancreas undergoes natural, gradual changes. Production of digestive enzymes can slowly decrease, and the way it handles insulin for blood sugar regulation may become less steady or efficient. These shifts can start influencing your appetite, energy, and ability to maintain weight well before any obvious or dramatic symptoms show up. Think of your digestive system as a bustling kitchen that's gradually losing its experienced staff. When the supply of key enzymes needed to break down fats, proteins, and carbs declines, food doesn't get processed as completely as before. Even if you're eating the same portions and types of meals, your body absorbs fewer nutrients and calories effectively. The outcome is frequently a slow, truly unexplained drop in weight that surprises you and often catches the attention of those around you first. You might find your clothes fitting more loosely at the waist or chest area. Friends or loved ones may point it out before you've even fully noticed. A Johns Hopkins study that tracked 1,500 adults aged 65 and older found that people with early pancreatic changes commonly lost 7 to 10% of their body weight in as little as 6 months, without any deliberate dieting, extra exercise, or major lifestyle alterations. You could easily tell yourself, I've probably just been eating a little less, or I feel full quicker these days, and label it as typical aging. But when weight loss like this continues without explanation, it always merits a serious conversation with your physician. One aspect that confuses so many people is the nature of pain linked to pancreatic problems. It is rarely sharp, sudden, or intense. More often, It's a dull, persistent, low-level ache centered in the upper abdomen or spreading to the middle of the back. Older adults frequently attribute this kind of ongoing discomfort to arthritis acting up, years of poor posture, or old injuries that never quite healed. However, issues in the pancreas can quietly irritate surrounding nerves and tissues, creating that steady ache that refuses to improve with rest, common pain relievers, physical therapy, or simply waiting it out. It's similar to a slow, unseen leak behind a wall. You can't spot it directly, but it's gradually causing harm. Inflammation develops quietly, producing those faint pain messages that are simple to ignore. Mayo Clinic data reviewing over 1,200 patients showed that 55% had experienced back or upper abdominal discomfort for 6 months or more before getting a diagnosis. If you're living with ongoing upper abdominal or mid-back pain that lingers without any obvious cause or relief, consider adding the word alert in your comment below. I want to know you're really tuned into this section. Another sign that becomes more noticeable, though still subtle, tends to show up somewhat later: jaundice. You see this as a yellow tint developing in the skin or the whites of the eyes, often paired with unusually dark urine or pale, clay-like stools. This happens when a tumor in the pancreas grows enough to press against or obstruct the nearby bile duct, interfering with the normal flow of bile, the fluid that assists in fat digestion. Bile flows steadily from the liver and gallbladder like a river carrying important digestive helpers. When blocked, it backs up, causing the yellow discoloration, itching, and changes in stool and urine color. Cleveland Clinic studies indicate that in roughly 65% of cases caught relatively early, jaundice follows milder symptoms, so its appearance is a powerful prompt to seek prompt, thorough medical evaluation. If you spot this change, don't delay. Since the pancreas is so central to insulin production and blood sugar balance, any decline in its function can lead to erratic glucose levels. This could show up as brand new diabetes developing after age 50, or unexpected struggles controlling blood sugar in someone whose diabetes was previously stable and well managed. Insulin works like a key, opening cell doors so sugar can enter from the blood and be used for energy. When that process falters, whether production drops, becomes inconsistent, or is otherwise disrupted, sugar builds up in the bloodstream, sapping energy and often increasing fatigue. A study in the journal Diabetes Care looked at 750 adults with sudden shifts in their diabetes and discovered that about 5% actually had early pancreatic cancer, a much higher rate than in the average population. The biggest mistake people make is looking at each symptom separately instead of seeing them as part of a connected group. Weight loss alone might seem tied to aging or lower appetite. Back pain by itself could appear musculoskeletal or posture-related. New or worsening diabetes might feel purely genetic or lifestyle-based. But when multiple signs cluster together, that pattern becomes a serious warning sign that calls for immediate attention. To make this more concrete, let me share 2 real patient stories that show exactly how these things unfold in daily life. First, there was Margaret, 68 years old. She had always stayed active and independent, daily walks, gardening, spending time with her grandchildren. Then, within 3 months, she lost 12 pounds without trying. She also developed a persistent dull ache in her upper back that stretching or rest didn't help, and she started feeling overly full after just small amounts of food she normally loved. When she came to see me, she was puzzled and concerned, saying nothing in my routine or eating habits has changed at all. We applied the early protocol right away, tracking her symptoms closely for a short time, running prompt blood tests, ordering the right imaging, and providing targeted nutritional guidance. The blood work showed elevated liver enzymes, and imaging spotted a small pancreatic lesion. Because we identified it relatively early, she was able to have surgery with positive results. She gradually regained 8 pounds, her energy came back fully, and she later told me, "I feel like my old self again. I'm grateful we didn't wait longer." Then there was Robert, age 72, who had managed stable type 2 diabetes successfully for 15 years with meds and steady habits. Over 6 months, though, his blood sugars became unpredictable despite no big routine changes. His stools turned pale, greasy, and hard to flush away, and he felt deeply fatigued even after sleeping well. At first, he didn't mention it, assuming it was just aging or perhaps a medication issue. When he finally did, we used the early protocol to link everything. Tests showed obstructive jaundice signs, and imaging confirmed a small tumor. Early surgery helped stabilize his sugars, reduce the fatigue, restore normal digestion, and restore his quality of life. Stories like these, and many hundreds more I've seen, clearly show how early focus on subtle, combined patterns can lead to dramatically better results. Now let's get to the exact protocol I use every day in my practice, the early protocol. The name emphasizes that recognizing patterns early truly makes all the difference. It's usually described in 5 main steps, but I often expand it to 6 for added emphasis on being thorough. First step, track changes carefully and consistently. Get into the habit of checking your weight weekly, noting appetite, any abdominal or back discomfort, fatigue patterns, stool appearance and consistency, and blood sugar variations if they apply to you. Keep it simple. Use a notebook, phone app, or whatever is convenient. Record dates, rate intensity from 1 to 10, and jot down related details like meals or activities. Patterns reveal far more than single moments ever do. Mayo Clinic research shows that regular tracking shared with a doctor can boost detection accuracy by up to 40%. Bring your notes to visits. Be precise. Rather than "I've lost weight," say "I've lost 10 pounds over 3 months, I get full quickly after eating, and my stools have been pale lately." Specifics like that trigger the correct tests: liver panels, bilirubin levels, imaging, and more. Second step, tackle modifiable risk factors head-on. If you smoke, make quitting a priority. Keep a healthy weight with balanced nutrition. Limit alcohol. Manage diabetes or prediabetes effectively if present. Cleveland Clinic data indicates these changes can lower risk progression by 20 to 30% for those at higher vulnerability. Add more fiber-rich foods, lean proteins, and good fats to aid digestion and steady blood sugar. Third step, ask for the right tests when patterns become clear. Begin with standard blood work checking liver enzymes, bilirubin, and, if appropriate, tumor markers such as CA-19-9. Then move to imaging, abdominal ultrasound, a CT with pancreatic focus, or MRI for clear views of the pancreas. Small early lesions require persistence. If symptoms persist unexplained, keep following up. Fourth step, focus on supportive daily habits. Drink plenty of water, choose nutrient-packed balanced meals, do gentle, consistent movement like walking or light weights, and support digestion overall. Gastroenterology studies show nutrient-dense eating during early symptom phases helps maintain energy and reduce issues. Tip: if enzymes seem low, doctor-supervised digestive enzyme supplements may help absorption, but only under guidance. Fifth step, put it all together for real empowerment. Commit to responding to those subtle signals instead of writing them off as aging. Following the early protocol consistently usually brings noticeable shifts. In week 1, patterns become clearer and worry decreases with a plan in place. Week 2 often brings test results and small diet or hydration adjustments that start improving energy or comfort. Weeks 3 to 4 guide further actions, referrals, more imaging, tweaks, and many feel better daily. After a month or more, it builds better long-term management, earlier detection potential, and smarter health decisions. This is active, structured empowerment, not just waiting passively. Important precautions. The early protocol is not medical treatment or a replacement for professional care. Never change or stop medications without your doctor's okay. If you have other conditions like heart or kidney issues, talk to your physician before big diet, supplement, or exercise shifts. Start gently and safely. The aim is awareness, timely checks, and smart risk reduction, not solo diagnosis. My challenge to you: choose one piece, maybe starting a symptom journal or one lifestyle change like more fiber or less alcohol, and stick with it for 30 full days. Then return here and share what you observed or felt. Your body has carried you faithfully for decades through every challenge. It deserves more than quick, it's just old age dismissals for ongoing changes. Tuning into those quiet messages gives you genuine power, clearer understanding, and wider choices ahead. If this resonated and felt useful, please subscribe. Next week, we'll discuss hidden liver disease signs in older adults, including one that surprises many people. Another frequently missed sign is a clear drop in appetite or feeling full very quickly after beginning to eat. It often develops slowly, a few bites in, and you suddenly feel stuffed like you've eaten a huge meal. Foods you once loved may no longer appeal. Some get mild nausea without vomiting, others just lose interest in food. While appetite can dip somewhat with normal aging from metabolism or taste and smell changes, new persistent unexplained shifts need attention. Pancreatic problems can slow digestion and create pressure affecting stomach emptying, causing malnutrition and more weight loss even without skipping meals. When someone says, "I just don't feel like eating," I dig deeper. How long? What else is happening? Related are changes in bowel habits, often awkward to mention, so they're ignored. Stools might turn pale, oily, bulky, hard to flush, or float more. Or new constipation or odd consistency appears. These often result from less bile or enzyme reaching the intestines. Undigested fats lead to greasy, smelly, floating stools, with or without jaundice. Seniors often blame diet or meds, but new unexplained changes call for discussion with a provider. Unexplained fatigue or weakness is another easy to overlook sign. Tiredness increases with age from sleep shifts, less activity, or chronic issues. But deep, constant exhaustion despite rest, or lost stamina for simple tasks, stands out. The body redirects energy to combat hidden problems. Profound fatigue can be an early indicator. Alone, it's seldom urgent, but combined with weight loss, appetite issues, or pain, it's far more meaningful. A rarer but notable sign is unexplained blood clots, sudden leg swelling, redness, warmth, pain often in the calf or thigh, or, if it moves to lungs, shortness of breath, chest pain, dizziness, rapid heartbeat. Some cancers, like pancreatic, subtly increase clotting risk without usual causes like immobility or surgery. Sometimes clots are the first clue prompting evaluation. Clots have many causes, but unexplained ones here warrant deeper look. The true strength comes from seeing combinations, not isolated symptoms. Appetite loss with unintended weight loss, stool changes with jaundice, fatigue with dull pain, new diabetes with digestive issues. One sign might be harmless or age-related. Multiple together become much more concerning. Your body often clusters signals when something serious brews underneath. Too many older adults stay quiet about these changes out of fear, of seeming overly worried, being brushed off, or discovering something bad. But speaking up shows strength and smart self-care. Listing multiple symptoms gives your doctor essential context for proper testing. Be factual and specific, duration, progression, full picture. Then return here and share what you observed or felt. Your body has carried you faithfully for decades through every challenge. It deserves more than quick, it's just old age dismissals for ongoing changes. Tuning into those quiet messages gives you genuine power, clearer understanding, and wider choices ahead. If this resonated and felt useful, please subscribe. Next week, we'll discuss hidden liver disease signs in older adults, including one that surprises many people. Another frequently missed sign is a clear drop in appetite or feeling full very quickly after beginning to eat. It often develops slowly. A few bites in, and you suddenly feel stuffed like you've eaten a huge meal. Foods you once loved may no longer appeal. Some get mild nausea without vomiting. Others just lose interest in food. While appetite can dip somewhat with normal aging from metabolism or taste and smell changes, new, persistent, unexplained shifts need attention. Pancreatic problems can slow digestion and create pressure affecting stomach emptying, causing malnutrition and more weight loss even without skipping meals. When someone says, "I just don't feel like eating," I dig deeper. How long? What else is happening? Related are changes in bowel habits, often awkward to mention, so they're ignored. Stools might turn pale, oily, bulky, hard to flush, or float more, or new constipation or odd consistency appears. These often result from less bile or enzyme reaching the intestines. Undigested fats lead to greasy, smelly, floating stools, with or without jaundice. Seniors often blame diet or meds, but new unexplained changes call for discussion with a provider. Unexplained fatigue or weakness is another easy to overlook sign. Tiredness increases with age from sleep shifts, less activity, or chronic issues. But deep, constant exhaustion despite rest, or lost stamina for simple tasks, stands out. The body redirects energy to combat hidden problems. Profound fatigue can be an early indicator. Alone, it's seldom urgent, but combined with weight loss, appetite issues, or pain, it's far more meaningful. A rarer but notable sign is unexplained blood clots. Sudden leg swelling, redness, warmth, pain often in the calf or thigh, or, if it moves to lungs, shortness of breath, chest pain, dizziness, rapid heartbeat. Some cancers, like pancreatic, subtly increase clotting risk without usual causes like immobility or surgery. Sometimes clots are the first clue prompting evaluation. Clots have many causes, but unexplained ones here warrant deeper look. The true strength comes from seeing combinations, not isolated symptoms. Appetite loss with unintended weight loss, stool changes with jaundice, fatigue with dull pain, new diabetes with digestive issues. One sign might be harmless or age-related. Multiple together become much more concerning. Your body often clusters signals when something serious brews underneath. Too many older adults stay quiet about these changes out of fear, of seeming overly worried, being brushed off, or discovering something bad. But speaking up shows strength and smart self-care. Listing multiple symptoms gives your doctor essential context for proper testing. Be factual and specific. Duration, progression, full picture. This guides urgency and steps. Blood tests for liver or inflammation, imaging for pancreas views, possible specialist referral. It's about collecting facts, not instant diagnosis. Prevention steps help too. No smoking, healthy weight, good blood sugar control, limited alcohol. Family history of pancreatic or related cancers? Tell your doctors. It counts. These don't erase risk entirely, but improve chances and build resilience. My core advice is simple. Stay alert to persistent, unexplained changes. Don't default to just getting older for every shift. Aging brings gradual, predictable changes, but not sudden, clustered, unexplained ones. Your body whispers messages constantly. Learning to hear them and respond early keeps you in control with more options. If any signs ring true, act, contact your doctor, note details beforehand, maybe bring a loved one for support and accuracy. Action brings the best information, not fear of the worst. Awareness builds the base. Action unlocks better paths. Please share this with someone over 60. It could make a real difference, maybe even save a life. These talks may feel uncomfortable at first, but they're essential. Tracking is central. Log weight, appetite, digestion, fatigue, blood sugar in a journal or app. Track onset, changes, patterns. Bring notes to visits. They catch subtle things doctors might miss otherwise. Review meds periodically. Some affect digestion or sugars, so separating them from warnings helps. Involve family or caregivers. They often spot what you don't. A companion at appointments adds perspective and ensures details aren't forgotten. This full approach, regular monitoring, smart lifestyle choices, nutritious, balanced eating, hydration, gentle exercise, stress and sleep attention, supervised supplements if needed, and close teamwork with your medical providers strengthens pancreatic and total health meaningfully. No guarantees exist, but these tilt odds favorably and prepare for quick, effective response if needed. Spotting these signs isn't about creating fear, it's about real empowerment via knowledge and doable steps. Keep watch for unexplained weight loss, appetite shifts, fatigue, digestive changes, new or worsening diabetes. Respond with steady tracking, healthy habits, and timely medical checks for the strongest health in later years. Pancreatic cancer exemplifies how grave conditions can start so quietly, with hints too easy to miss. We often expect sudden, obvious onset, but it usually builds gradually through understated clusters. When they combine, don't dismiss them. Your body messages you always. Learning to listen is crucial. Early response isn't assuming doom, it's proactive care, preserving options. Blend strong awareness with practical actions for greater health control. Share this message widely. It can change lives, empower yourself and loved ones, transform quiet whispers into timely, clear signals for better results and peace of mind.